I've selected 10 aesthetic medicine procedures for you that don't work. Which procedures are they? See for yourself. My name is Monika Wijwa and I'm an aesthetic medicine doctor from Krakow. And here's procedure number 1 that doesn't work. Fibrin under the eyes for the tear trough. How many times have you heard that fibrin is a great procedure because it's 100% natural? And that platelet-rich fibrin is a natural filler? Exactly. Except that's not true. Platelet-rich fibrin is not a filler, meaning it's not a natural and better alternative to hyaluronic acid. Fibrin is indeed thicker than plasma, but it won't fill the tear trough scars, nor can it be used for facial volumetry. Fibrin can be injected under the eyes and achieve nice revitalization effects, but this procedure won't help with the tear trough. Alright, so if not fibrin, what else can be used under the eyes? Maybe tissue stimulators like polylactic acid? And it's exactly this thought that leads me to the second procedure I don't recommend. Procedure number 2 that I advise against. Polylactic acid under the eyes. I don't recommend this procedure not because it doesn't work, it can work, but because it carries a very high risk of complications. Polylactic acid is one of the strongest tissue stimulators. However, it's a bad solution under the eyes because the skin here is extremely thin, being about 0.5 millimeter thick. In such a sensitive area, it's very easy to develop complications like lumps or granulomas, which cannot be dissolved or massaged away. If such lumps appear, the only solution would be to remove them surgically because they won't disappear on their own. I have never performed and will never perform a polylactic acid treatment under the eyes for any of my patients because it's an unnecessary risk. Especially since there are other stimulators for the under eye area that are worth considering. I talk about them in this video. Save it for later. Speaking of frequently recommended treatments that don't work, the third point will definitely surprise you. The third treatment that doesn't work is lifting drooping eyelids using plasma. Plasma for drooping eyelids is a non-surgical method of eyelid skin lifting, which is based on targeted contraction of the epidermis and stimulating the skin to regenerate. The goal of the procedure is to lift the eyelid, tighten the skin, and improve its firmness without the use of a scalpel. Sounds great, right? However, unfortunately, the problem is that you probably won't be satisfied after this procedure. Why? To put it simply, the amount of skin that accumulates on the eyelids is too great for non-invasive methods to handle. So this kind of plasma will shrink the eyelids, but it won't create a significant enough change to notice a real difference. That's why, instead of spending money on plasma and getting only 5% of the eyelid lifting effect, it's better to do it properly once, have a surgical eyelid lift, and have the issue taken care of for at least a dozen years. What's more, the plasma procedure carries a high risk of complications, burns, scars, and discoloration. All of this is because the procedure is not automated. Every single spot of burning and stimulation is done manually, without precise control over the depth and intensity of the treatment. Currently, there are no non-invasive alternatives to surgical eyelid lifting that I could recommend to you or to my patients in the office. However, there's definitely no need to be afraid of this procedure, because in the hands of a good doctor, the results will be spectacular. Let's stay on the topic of weak substitutes for procedures. Let's move on to the next procedure that doesn't work. Procedure number 4 that doesn't work is using tissue stimulators instead of hyaluronic acid. These are two different procedures, and you can't replace one with the other. It's like trying to replace ham on a sandwich with yellow cheese. You can put both on a sandwich, but cheese won't give you the taste of ham, and vice versa. What I mean is that tissue stimulators are presented on social media and in clinics as an alternative to hyaluronic acid that will give a more natural look. My example with cheese and ham is simple, but believe me, when I look at social media, I constantly see someone in a clinic trying to replace ham with cheese and confidently claiming it tastes just like ham. It's not true that tissue stimulators can replace hyaluronic acid. That's because aging doesn't affect just the skin, but every layer, bone, muscle, and subcutaneous tissue. And so we see that as we age, the skin becomes thinner, but the facial profile also becomes flatter, or the skin starts to sag in the facial hollows, causing jowls. And now, pay attention. Tissue stimulators will help with thin skin, but they won't address the loss of subcutaneous tissue and the sagging caused by it. Tissue stimulators are not fillers, and will not replace the subcutaneous tissue lost with age. That's a job for hyaluronic acid. The only alternative to filling with hyaluronic acid is lipotransfer, that is, a transplant of your own fat. Speaking of hyaluronic acid, there is a situation where it's definitely not worth using it, and that's what the next point is about. Procedure number 5 that doesn't work is lip contouring with hyaluronic acid when you have an uneven lip contour or a light pigment. Do you know those beautiful before and after effects on Instagram where the lips are pale and have an uneven edge, but after the procedure they're not only bigger but also redder and have a beautiful contour? Unfortunately, it's not the hyaluronic acid that gave a better color and contour. A filler injected into the lips won't even out a blurred vermilion border or change the naturally light color of the lips. And what you see on Instagram is a scam. And to be more specific, lips shown in after photos are usually specially prepared to look perfect in every way. That means lip gloss is added, the right photo angle is chosen, makeup, lipstick, and suddenly the lips are unrecognizable. But hyaluronic acid is not responsible for the effect you see in the photo. Even the best specialist can't make a blurred lip contour reappear just by using hyaluronic acid. So what or who can actually restore the contour and improve the color? Permanent makeup. In many cases, makeup can actually be a better option for you than filler, which only adds volume. There's one more hyaluronic acid procedure that doesn't work and that you need to know about because it's very popular. Procedure number 6 that doesn't work is hyaluronic acid for dark circles under the eyes when you don't have a tear trough. You need to know that the area around the eye is very difficult to diagnose. It's not always easy to determine what the real cause is, why the lower eyelid looks tired and the patient has dark circles under their eyes. The best example of such an incorrect assessment by a specialist is performing a hyaluronic acid procedure when there is no tear trough. The cause of a tear trough is a loss of subcutaneous tissue, which creates specific indentations under the eye in the area where tears flow when you cry. That's where the name tear trough comes from. In point 4, I told you that we use hyaluronic acid when there are losses in the subcutaneous fatty tissue. And now, attention. Such losses, if they occur, can cause dark circles under the eyes, but that doesn't mean that the cause of dark circles is always the tear trough. Quite the opposite. There are actually many causes. Unfortunately, surprisingly often this problem is misdiagnosed, and fillers are used to treat dark circles under the eyes. Not only does this not work, but it is a medical error and over time leads to a worse appearance than before the procedure. Swollen eyes and an artificial look are possible outcomes. If you want to find out what actually works for dark circles under the eyes, check out that video later. But for now, I'll tell you about tissue stimulators which, despite their popularity, do not work. Procedure number 7, which doesn't work. Soft tissue stimulators administered in 5 points. If what I just said sounded to you like chicken in 5 flavors, let me explain. Tissue stimulators can be divided into soft and hard types. This is an informal, not official classification, but it's very important. The point is, there's currently a huge trend for tissue stimulators. For this reason, every manufacturer wants to call their product a stimulator to catch on to this trend and sell their product. It's a trend similar to the one with high-protein products in supermarkets. Now, everything is labeled as high-protein because it sells, even though the differences in actual content are often minimal. But people buy it because it seems better and healthier. Soft tissue stimulators are exactly those kinds of products that won't actually provide a strong stimulation effect, but are more about moisturizing or regenerating the skin. On the other hand, the hard stimulators such as polylactic acid, calcium hydroxyapatite, and polycaprolactone really do the job when it comes to stimulating the skin to produce collagen. Now that you know what soft stimulators are, what does it mean when they're administered in 5 points? It's simple. If a tissue stimulator is to be administered using the 5-point technique, that is, with a total of 5 injections into the cheeks, jawline, and chin, it will belong to the group of soft stimulators, meaning those with a minimal effect on new collagen production. So here's a tip for you. If your practitioner suggests a tissue stimulator administered in 5 points, it's better not to do it because it won't provide the stimulation effect you're probably expecting. Interestingly, the same stimulators can be administered using a non-5-point technique and then their effectiveness increases. If you'd like me to record a video on this topic, let me know in the comments. But enough about hyaluronic acid. The next point about treatments that don't work concerns very popular laser procedures. Treatment number 8 that I don't recommend is ablative lasers or microneedle radiofrequency if you have dry skin. It may seem like nothing major at first glance, but in practice it's a big problem for the skin, and people don't talk about it. It's not the case that if you get radiofrequency or laser treatments, your skin will always look better. You absolutely need to know that these technologies mentioned strongly evaporate water from the skin during the procedure. And that means if your skin was already dry and dehydrated before the procedure, you could simply burn it. Imagine a frying pan that you heat until it's red hot on an induction stove. You want to throw a steak on it, but you forgot to add oil or olive oil. When you throw the meat onto the pan, there's a lot of smoke burning and the steak just doesn't turn out right. Just like the steak doesn't turn out, the same goes for a laser treatment or radiofrequency procedure if your skin lacks water. So despite the potentially beneficial effects that come from stimulating the skin with such devices, you end up experiencing the very unpleasant effects of a burnt steak. So you can definitely expect more discomfort, longer healing time for wounds after the procedure, and a much higher risk of burns and scars on your skin if the settings are too aggressive. In short, water can save your skin, both literally and figuratively. I've written a great ebook called Understanding Cosmetics, which will finally help you choose high-quality cosmetics. In the book, I recommend as many as 140 products with excellent ingredients. It's a book that will pay for itself in no time because you'll stop buying cosmetics that don't work. Check out the link in the description below the video and see for yourself why so many people have decided to buy it. So, if your doctor suggests hydrating mesotherapy before a laser procedure, it's probably worth listening to them. I have one more tip that could save your skin, and I'll talk about it in the next point. The 9th procedure I don't recommend is strong tissue stimulators if you're planning a surgical lift. A surgical lift is nothing more than removing excess skin to lift and reposition the tissues, restoring a more youthful appearance. To put it simply, a surgical lift will give you the effect as if you stood in front of a mirror and pulled your facial skin tight. Exactly. However, strong tissue stimulators performed a few months before a lift won't be helpful. In fact, they'll actually make it harder for the surgeon to do their job. That's because the role of stimulators is to densify loose skin and make it physically thicker. It's a bit like wanting to move a dresser in your living room, but right before rearranging, you fill the dresser with books and other heavy things. And then it would be harder to move such a piece of furniture and set it in a new place. Does that mean that after using strong stimulators, surgical lifting becomes impossible? Definitely not. A stimulator introduced into the body forces the skin to produce new collagen, and with strong products, this process can last even several months, but eventually it does come to an end. That's why the safe interval between tissue stimulators and a lifting procedure is 2 years. Let me remind you, I'm not talking here about the mild tissue stimulators, but about the strongest ones, namely polylactic acid, polycaprolactone, and calcium hydroxyapatite. Moreover, since we have to wait several months for the effects of these treatments, it makes no sense to perform such procedures right before a lifting because we simply won't see the results. The last point I have prepared for you concerns a very popular procedure, namely mesotherapy. Procedure number 10, which doesn't work, is scalp mesotherapy without a dermatological diagnosis. On Instagram and clinic websites, scalp mesotherapy is presented as a cure-all procedure, suitable for every type of hair loss. Weak hair for women, for men, for hair loss after pregnancy, and literally for every problem related to the scalp and hair. However, it's not the case that mesotherapy will help with all of these problems. Quite the opposite. If you don't get a proper dermatological diagnosis, and you have weak and thinning hair and decide to undergo mesotherapy, there's a good chance it won't help you, and your wallet will simply get lighter. Scalp problems, hair loss, and weak hair can have many different causes. We cannot and should not reduce this to a single simple solution like scalp mesotherapy. Instead, I recommend consulting a dermatologist and getting the appropriate test done, both blood tests and a dermatoscopic examination, to find the real cause of your problem. If, at that point, mesotherapy turns out to be a good choice, that's great, but there's a high chance it will be otherwise, and blindly performing mesotherapy simply won't work. Dear ones, in this video I talked to you about which treatments won't work, but I also want to give you a ray of hope. Earlier in this video I talked about which treatments you definitely shouldn't do under the eyes. I've recorded a special video on this topic, in which I discuss which tissue stimulators for the under eye area I recommend, and which ones truly work for specific problems around the eyes. Only after watching that video will you be able to make the right decision at the clinic. The thumbnail for that video is now showing on the screen, so click and keep watching to learn more about smart skincare. I also have a huge favor to ask. If this video you just watched was valuable to you, please leave me a comment below for better reach. Thanks to that, YouTube will show it to more people. Thank you for that, and thank you for watching my videos. See you in the next one. Sweet kisses.